Hey everyone, welcome back to the Deep Dive, the show where we, take all that research you've been meaning to get to and break it down into the really important stuff. I'm Hario, and I'll be guiding you through today's deep dive.
And I'm Kimi. Nice to be here.
And we're going to be talking about something that, maybe you've been thinking about a little bit more lately as you get older.
Oh, yeah.
The other day I was thinking, the only thing that's growing faster than my honey-do list is probably my prostate.
That's one way to put it.
At least it's not my credit card debt.
True, that's true. And speaking of prostates, that's exactly what we're diving into today. Prostate cancer. We're going to break down all the key information from that Wikipedia article we've got, cutting through all that jargon, and hopefully by the end you'll feel more informed and not overwhelmed.
Yeah, exactly. And before we get into all the details, I think it's important to remember that, cancer can be a scary word. But the good news is most prostate cancers are actually slow growing.
Hmm.
And a lot of men live long lives without even experiencing any symptoms.
Yeah, that's true.
Autopsies have actually shown that a really high percentage of men over 50 have prostate cancer, but a lot of them never even knew it.
Wow.
So let's start by defining what prostate cancer actually is. Can you give us the rundown on that and maybe explain why screening is so important, even if there aren't any obvious problems?
Sure. So prostate cancer is when cells in the prostate gland, which is the small gland just below the bladder in men, start growing uncontrollably. And the thing is, early stage prostate cancer often doesn't have any noticeable symptoms. So regular screening is really important, especially as men get older. One common way to screen is with the PSA test, which stands for prostate specific antigen.
Yeah, okay.
It's a blood test, and it measures the levels of a protein that's produced by the prostate gland. Now, an elevated PSA level doesn't automatically mean cancer, but it does mean that it might be time for further investigation.
So it's kind of like a smoke alarm, right?
Ac-
Doesn't necessarily mean there's a fire, but it's a good sign to, just double check things out.
So what happens if the PSA test does raise a red flag? What are the next steps to figuring out if it's actually cancer?
Well, if the PSA test comes back high, or a digital rectal exam, which is also called a DRE, reveals any abnormalities in the prostate, the next step is usually a biopsy. So they take a small sample of prostate tissue and examine it under a microscope to look for cancer cells. And if cancer cells are found, then a pathologist will actually grade them based on how aggressive they look and assign what's called a Gleason score.
Okay,
That helps doctors figure out the best way to treat it.
makes sense. So it's not just about detecting if cancer is there, but it's about understanding, how it might behave.
Exactly.
And I know there's been a lot of debate about the PSA screening over the years.
Yeah.
Some people say it leads to overdiagnosis and unnecessary treatment for cancers that might never have caused any issues. Where do things stand on that debate these days? It's definitely a complicated issue. You have to weigh the benefits of early detection with the possible downsides of overtreatment. Current guidelines generally recommend that men who are at higher risk, maybe because of age or family history or ethnicity, talk to their doctor about the pros and cons of PSA testing and make an informed decision together. There are also some newer screening tools like the Prostate Health Index and the 4K score that offer a more precise risk assessment compared to just the PSA test alone.
So it's all about personalized medicine, basically,
Exactly.
taking into account each person's individual situation and risk factors. Let's say a biopsy does confirm that there's prostate cancer. What happens next? How do they figure out how advanced the cancer is? And what are the key things to understand about staging?
So, and once a biopsy confirms that it is prostate cancer, the next big thing is figuring out what stage the cancer is at. Basically figuring out, how far it has spread and how aggressive it is. This helps doctors decide on the best way to treat it. So imaging techniques like an MRI or a bone scan can show if the cancer is still contained to the prostate or if it spread to the lymph nodes or other organs like the bones. And then based on this information, the cancer is assigned a stage. They use systems like the AJCC or the Cambridge Prognostic Group. A higher stage usually means it's more advanced and could be more serious.
So it's like creating a roadmap of where the cancer's been and where it might be going.
Yeah.
And I imagine the treatment options probably vary a lot depending on the stage and a bunch of other factors.
Yeah.
Can you give us an overview of like the main treatment approaches for prostate cancer and what kinds of things might influence which treatment is chosen over another?
Yeah, for sure. Treatment is very personalized, and it depends on not just the stage of the cancer, but also the patient's age, their overall health, and their own personal preferences. So for low-risk cancers that are slow-growing and still within the prostate, they might recommend what's called active surveillance. That's like a watch-and-wait approach. It involves regularly monitoring things with PSA tests and DREs, and sometimes even more biopsies, just to see if the cancer is becoming more aggressive.
Okay.
If they need more active treatment, there are two main options: radiation therapy and radical prostatectomy.
Okay, so it's not always about rushing to intervene right away if the cancer isn't immediately dangerous.
Yeah.
Can you break down those two main treatment options a little bit more? Like, what are the pros and cons of each? And what are some situations that might make one better than the other?
Sure. So radiation therapy uses high energy rays to target and kill cancer cells. There are a few different types, like IMRT, which stands for intensity modulated radiation therapy, and brachytherapy, where they actually implant radioactive seeds directly into the prostate.
Oh, wow.
Radiation can be a good option for men who aren't healthy enough for surgery, maybe because of their age or other health problems, and it usually has fewer side effects than surgery.
Yeah.
Radical prostatectomy, on the other hand, involves actually removing the entire prostate gland along with some of the surrounding tissue. This can be done with traditional open surgery or with the help of a robotic system, which can be more precise and maybe even make recovery faster. Surgery might be a better choice for younger, healthier men with cancers that are still localized who want to try and cure the disease completely.
Wow, robot-assisted surgery. That sounds so futuristic.
Yeah.
So both radiation therapy and surgery try to get rid of the cancer, but they go about it in very different ways. So what happens after the treatment? How do they know if it worked? And what if the cancer comes back?
Well, after the treatment, they monitor PSA levels really closely to make sure that they stay low. That's a sign that the treatment has been successful. But if PSA levels start going up again, it could mean the cancer has returned or spread, and they might need more treatment.
Okay.
Now, for men who have advanced prostate cancer that has spread beyond the prostate, they often use hormone therapy to slow down the cancer's growth. They do this by reducing the levels of testosterone in the body, because testosterone actually fuels prostate cancer cells.
Well, it's like cutting off the cancer's food supply.
Exactly.
Right.
But hormone therapy can come with some pretty significant side effects.
Yeah, I can imagine. Can you talk about those a little bit? And what happens if the cancer actually becomes resistant to the hormone therapy?
Yeah, so hormone therapy can cause side effects like hot flashes, fatigue, a decrease in bone density, and even mood swings.
Wow.
And unfortunately, sometimes those prostate cancer cells can become resistant to hormone therapy. It's called castration-resistant prostate cancer, or CRPC. It's a really tough situation, but there are still treatment options available like chemotherapy, newer types of hormone therapy, and immunotherapy, which uses the body's own immune system to fight the cancer.
So it sounds like there are a lot of different ways to fight prostate cancer, even when it's advanced. That's all super insightful, but we still have a lot more to talk about. Let's switch gears a bit and talk about what might actually cause prostate cancer in the first place. Is it just bad luck? Or are there things that make a man more likely to get it?
You're absolutely right. Living with metastatic prostate cancer can be incredibly hard, both physically and emotionally. One of the most common and toughest symptoms to deal with is bone pain.
Yeah.
And it can range from, mild to really severe. And that can have a big impact on someone's ability to move around and just their overall quality of life. Thankfully, there are ways to manage bone pain, things like pain meds, radiation therapy that's targeted at the affected bones, and even medications that help make bones stronger. But beyond the physical symptoms, there's the emotional aspect of living with a serious illness. Men who are dealing with metastatic prostate cancer and their families really need support on every level.
Yeah, it's so important to think about the whole person, not just the disease itself. Are there resources and support systems that are specifically for men with metastatic prostate cancer and the people they love?
Mhm.
And what about all the other challenges they might face, like how to manage the side effects of treatment, dealing with money worries, or even just navigating the whole healthcare system?
Oh, definitely. There are lots of organizations that are dedicated to helping men with prostate cancer and their families. The Prostate Cancer Foundation and the American Cancer Society have a ton of information resources and support groups. They connect people who are going through similar things. And there are also social workers and patient navigators who can help patients and families understand their treatment options, find financial assistance programs, and get emotional support. And remember, it's so important to keep those lines of communication open with your healthcare providers. Don't be afraid to ask questions, talk about your worries, and really advocate for what you need.
That's a really good point. Knowledge is power, and having people to support you can make all the difference. As we wrap up our deep dive into prostate cancer today, I'm thinking about how complex this disease really is. There's no one-size-fits-all answer, and there are so many things to think about, from the stage of the cancer to the individual's overall health and their personal values. But I'm also feeling hopeful because of all the advancements in research and treatment and the growing awareness of how important early detection and prevention are. What's the one main message you want our listeners to take away from our conversation today?
I think the most important thing to remember is that prostate cancer is highly treatable, especially when it's caught early. So be proactive about your health. Talk to your doctor about your risk factors and screening options. Live a healthy lifestyle. And don't be afraid to reach out for help if you need it. Even in cases of advanced prostate cancer, there are ways to manage the symptoms and maintain a good quality of life.
That's a great way to put it. Thank you so much for joining us on this deep dive into prostate cancer. We hope you found it informative and helpful. Until next time, stay curious, stay informed, and stay well.